Dear my children, today I will discuss OCRD. The full form of OCRD is Obsessive Compulsive and Related Disorder. Now students, just you see. Okay students, just to identify in which disorder I will first discuss. Yes, this is OCD. The full form of OCD you know, Obsessive Compulsive Disorder. Up to DSM 4th year, OCD was a part of anxiety disorder. But DSM 5, OCD is a part of OCRD. And just you think students, and I am cleaning my hands. Yes, why I am cleaning my hands? I think that my hands are dirty. That's why I clean my hands again and again. Yes. So obsession means your intrusive, persistent, recurrent thoughts or images. And compulsion means our behavior. Okay, I just clean my hands. Why? I want to resolve my thought. Yes. And compulsion, you know students, is two types, is overt and covert. And overt means which are expressed, that means cleaning is expressed. Yes. And checking, washing are overt compulsion. And covert, which is internal. Yes, that means praying, counting is, if you know, is covert compulsive behavior. So now students, and again I repeat, obsession means, you know, our thinking. Compulsion means our behavior. Yes, and various kinds of counting, praying, checking, everything, washing, and the people, you know, the who are suffering obsessive compulsive disorder, they think that the clothes in any kinds of things are not proper. Yes, and compulsion, that's why, and they just engage these various kinds of behavior. Okay, and now students, only for your information, and for obsessive compulsive disorder, the abnormalities of serotonin, yes, and the some brain parts, you know, orbitofrontal cortex, cingulate cortex are responsible for obsessive compulsive disorder. And according to psychodynamic theory, the Freud said the people who are suffering obsessive compulsive disorder, they use some defense mechanisms such as undoing, denial, and reaction formation. Okay, and exposure prevention therapy, cognitive behavior therapy are effective for obsessive compulsive disorder. Now students, the hoarding disorders. That means people with hoarding disorder, they save items and others may view that useless items. Yes, so this is hoarding disorder, and your book hasn't mentioned the explanation of hoarding, trichotillomania, body dysmorphic and excoriations. Only for your knowledge I am explaining. Yes, so now hoarding disorder, that means the people with hoarding disorder, they hold some items and useless item, but they hold this item, they save these items. And in the collector, they are different. Yes, collector, and the people just collect various coins, stamps, etc. And now under OCD, after hoarding disorder is body dysmorphic disorder. Yes, so body dysmorphic disorder was part of somatoform disorders up to DSM 4th year. But in DSM 5, body dysmorphic disorder is a part of OCRD, that means obsessive compulsive and related disorder. Body dysmorphic disorders, the people with body dysmorphic disorders, and they are preoccupied with their imagined body defect. Yes, And and the people with BDD, that means body dysmorphic disorders, and they have intrusive thoughts about their body image. Yes. And now, next, trichotillomania, also a part of obsessive compulsive and related disorder. And people just pull their own hairs. Yes, it's from eyebrows, scalp, and any kinds of arms. Okay. And now next, excoriation, and repeatedly and just picking their skin, okay, and just lead to tissue damage. Okay, students. So, and under OCD, that means obsessive compulsive disorder, hoarding disorder, body dysmorphic disorder, trichotillomania, and excoriation. Okay. Now move to another part. Trauma and stressor related disorder. Now what is trauma? Trauma is a Greek word for wound. And Greek used these words only for physical injury. And nowadays we use these words along with physical injury and emotional injury. Now, under trauma and stressor related disorders, that means the classification of trauma and stressor related disorders are PTSD, that means post-traumatic stress disorder, acute stress disorder, and adjustment disorder. Your book has only mentioned PTSD and just mention the name acute stress disorder and adjustment disorder. Now, PTSD, that means post-traumatic stress disorder. After trauma, people may develop post-traumatic stress disorder. Trauma, is a preoccupation, is a condition of any kinds of physical, emotional injury, okay? And now, and psychological injury also. And now, that means trauma such as, natural disaster like tsunami, Amphan, Ayla, any kinds of combat situation also, okay? And any kind of sexual harassment, and people may develop post-traumatic stress disorder. And the symptoms of post-traumatic stress disorder, flashback, yes, and insomnia, that means lack of sleep, lack of concentration, forgetfulness, and always want to avoid from traumatic incident, yes. So these are the symptoms of post-traumatic stress disorder. And students, and post-traumatic stress disorder, the difference between post-traumatic stress disorder and acute stress disorder, okay? And if symptoms begin within 4 weeks and less than a month, and according to DSM-5, acute stress disorder, that means diagnosis is given for acute stress disorder, and the symptoms continues for a month. Yes, continues after months, and just PTSD, the diagnosis of PTSD is given, okay? And after traumatic experience, people may develop PTSD sometimes, that means after months, years, okay? And any stage, people may develop PTSD, post-traumatic stress disorder, okay, students? So, under trauma and stress related disorder, one is PTSD and acute stress disorder. And also PTSD and acute stress disorder, the exposure prevention therapy and cognitive behavior therapy are effective. Thank you, my children.